Strong bones are much like the sturdy framework of a house. They provide essential support for our bodies, enable movement, and safeguard our vital internal organs. When this foundational strength diminishes, a condition known as bone loss occurs. This weakening often progresses quietly and slowly, frequently without any noticeable symptoms until a bone unexpected century. This silent threat can lead to medical conditions such as osteopenia, where bones are weaker than normal, and osteoporosis, a more severe state where bones become very porous and fragile. Many individuals experience these conditions, which can significantly impact daily life, making simple activities challenging and greatly increasing the risk of century. The encouraging news is that there are many effective actions one can take to protect and even strengthen their bones. This discussion will outline a clear, straightforward plan, exploring how diet, physical activity, and daily habits all contribute to building and maintaining robust bones. We'll learn simple, actionable steps centered on nutrition, exercise, and lifestyle adjustments that can help prevent bone loss and enhance overall bone health. Are static, unchanging structures. They are dynamic, living tissues constantly undergoing a process called bone century. In this continuous cycle, old bone is broken down, a process known as resorption, and new bone is formed to replace it, ensuring our bones remain strong. Century. Bone loss occurs when the rate at which old bone is broken down outpaces the rate at which new bone is built. There are two primary stages of this bone weakening: osteopenia, which indicates low bone mass where bones are weaker than they should be but not yet as fragile as in osteoporosis, serving as a vital warning sign to take century. The more serious condition, osteoporosis, involves bones becoming very thin and porous, resembling a sponge within century, making them extremely fragile and significantly more susceptible to fractures from even minor falls or bumps. Several factors can contribute to century. As we age, our bodies naturally slow down the process of building new bone. Typically, after about age 30, most individuals begin to slowly lose more bone than they build. Hormonal changes also play a significant role, particularly for women, where menopause causes a substantial drop in estrogen, a hormone crucial for bone protection. Early century. Low testosterone levels in men can lead to bone loss, and thyroid problems may also contribute. Nutritional deficiencies are another key cause. If the body lacks essential nutrients such as calcium, vitamin D, vitamin K2, and magnesium, it cannot effectively build and maintain strong century. Certain lifestyle factors, including a sedentary lifestyle, smoking, and excessive alcohol consumption, can also severely harm bone health. Various medical conditions, such as celiac disease, inflammatory bowel disease, rheumatoid arthritis, kidney disease, and an overactive parathyroid gland hypertension, can exacerbate bone loss. Medications can also weaken bones, including long-term use of corticosteroids like prednisone, some stomach acid blockers, proton pump inhibitors, medications, century. A number of major risk factors can increase an individual's likelihood of developing bone century. Gender is a significant factor, with women, especially after menopause, facing a higher century. Medical research indicates that approximately 1 in 2 women and up to 1 in 4 men over 50 will experience a bone fracture due to osteoporosis. Genetics and family history also play a role. If parents or grandparents had osteoporosis or suffered a hip fracture, an individual might be at a higher risk. Ethnicity is another consideration, as people of Caucasian and Asian descent tend to have an elevated risk. Individuals with a small, thin body frame often have less bone mass to begin with, making them more susceptible to bone loss. Finally, a history of previous fractures from minor falls can be an important indicator that bones are already weak. Early diagnosis of bone loss is crucial for initiating effective treatment. The most common and effective method for assessing bone health is bone mineral density (BMD) testing, DXA dual energy X-ray absorptiometry. This quick, painless X-ray measures bone density, typically in the hip and spine, providing results that help doctors understand an individual's risk. Century blood tests may also be ordered by doctor to check levels of calcium, vitamin D, and parathyroid hormone PTA. These tests can help identify if a nutritional deficiency or another medical condition is contributing to bone loss. Century. Sometimes specific markers, which indicate the rate at which bone is broken down and built, are also assessed. Century. Additionally, doctors can utilize fracture risk assessment tools like the FRAX score, which considers factors such as age, density, and medical history, century, to estimate of breaking a bone within the next 10 years. Century. Building and maintaining is a collaborative effort involving dietary choices, physical activity, and daily habits. Century. A simple, actionable plan to help strengthen bones begins with nutritional foundations, specific building blocks, and tools your bones need to stay strong. Century. Calcium is responsible for giving bones their hardness and strength. Century. Without sufficient calcium, the body will draw this mineral from the bones to perform other vital functions, such as regulating heartbeat actions. Century, which gradually weakens the bones over time. Calcium is essential for both building and maintaining bone structure, and most adults require about 1,100 milligrams (mg) of calcium daily, although this can vary by age and gender. And so consulting a doctor is advised. Excellent natural sources include dairy products like milk, yogurt, and cheese, with a cup of milk or yogurt providing approximately 300 mg of calcium. Dark green, leafy vegetables such as kale, greens, turnip greens, and bok choy also contain calcium. Plant milks, orange juices, and breakfast cereals are fortified with calcium. Fatty fish like sardines and canned salmons, when consumed with their soft bones, are also good sources. Centuries are beans and sesame seeds. Century. Even if you consume, your body cannot properly absorb it without enough vitamin D. Vitamin D acts like a key, unlocking your gut to allow calcium to be absorbed from food. Century. For the body to absorb calcium from the stomach and integrate it into the bones, and it also supports bone growth and remodeling. Adults need 600-800 international units (IU) of vitamin D daily, though some individuals, particularly older adults or those with low levels, may require more as advised by their doctor. The skin produces vitamin D when exposed to sunlight, with about 10-15 minutes of direct sun exposure several times a week being helpful, though this varies significantly based on skin type and geographic location and time of day. Fish like salmon, mackerel, tuna, and cod liver oil are among the best dietary sources. Many milks, yogurts, cereals, and some orange juices are fortified with vitamin D. Smaller amounts can be found in egg yolks and some UV-exposed mushrooms. Vitamin K2, or menaquinone, is a less recognized but highly important vitamin for bone health. It functions as a traffic control, ensuring calcium is directed into the bones and kept out of inappropriate places, such as the arteries. Medical research supports vitamin K's role in bone health as it activates special proteins like osteocalcin and MGP that help bind calcium to the bone matrix and prevents calcium buildup in the arteries, benefiting essential. While there is an official recommended daily amount for K2 yet, clinical studies often utilize doses of 91-80 micrograms (mcg) per day, especially for the MK7. Century. Japanese fermented soybean dish is by far the richest source of MK. Some cheeses, such as Gouda and Brie, also contain K2, as do egg yolks, liver, and dark chicken meat, which provide MK4, another form of K2. Century also contains some K2 due to bacterial fermentation. Magnesium is another mineral crucial for bone health that often receives insufficient attention. Over half of the body's magnesium is stored in the bones, and it participates in numerous bodily processes, including activating vitamin D and supporting bone-building enzymes. Magnesium is a key component of bone structure, helps activate vitamin D, and is necessary for many enzymes that support bone health. Adult men generally need 400-420 mg daily. While adult women typically require 300 and 320 mg daily. Excellent natural sources include nuts and seeds like almonds, cashews, pumpkin seeds, and chia seeds. Whole grains such as brown rice, oats, and whole wheat bread also provide magnesium. Leafy greens like spinach and Swiss chard, and legumes like black beans and lentils. Avocado, dark chocolate, and bananas also contribute to magnesium intake. When considering protein, we often associate it with muscles, but it is equally vital for bones. Bones are composed of a strong protein framework, primarily collagen, which is then mineralized with substances like calcium. Protein provides this essential framework for bones and helps maintain muscle mass, which is critical for balance and reducing the risk of falls. Most adults need about 0.81 grams of protein per kilogram of body weight daily, with older adults potentially needing a bit more, around 1.0-1.2 gg, to protect both muscle and bone. For example, a person weighing 70 kg 1f4 lb would require approximately 670 grams of protein daily. Good sources include lean meats, poultry, fish, eggs, dairy products, legumes, beans, lentils, tofu, quinoa, and nuts, while calcium, vitamin D, K2, magnesium, and protein are the primary nutrients for bone health. Other nutrients also play supportive roles. C is important for producing collagen, the main protein in the bone framework. Potassium helps reduce the amount of calcium the body loses through urine. Century. Boron uses calcium and magnesium, and zinc is involved in bone formation and mineralization. Century. Benefit bones. Others can be detrimental if consumed in excess. Excessive sodium intake can cause the body to lose more calcium through urine. Century. Caffeine intake might slightly increase calcium loss, although this effect is generally small if calcium intake is adequate. Drinks like sodas and sugary juices have been linked to lower bone density in some studies, potentially by displacing more nutritious beverages. Processed foods often lack the necessary nutrients for bones and may contain ingredients not beneficial to health. Century. Excessive alcohol consumption, bone formation, and nutrient absorption. Century. Foods high in oxalates such as spinach, rhubarb, and beet greens can bind to calcium and reduce. However, for most people, the benefits of these foods affect Century and calcium can still be absorbed from them. Century. Individuals prone to kidney stones may receive specific dietary advice from their doctor regarding oxalate intake. And exercise is crucial for bone strength and fall prevention. Muscles, bones respond to stress by becoming stronger. Century. When you engage in physical activity, particularly movements, you send signals to your bones to produce more cells and increase their density. Exercise bone building cells known as osteoblasts. The physical stress from activities, especially strength training, prompts these cells to create new bone tissue. Century. Regular exercise can increase bone mineral density, making bones stronger and less prone to fractures. Century. Improves balance, coordination, and muscle strength, which are vital for reducing the risk of falls, particularly for those with weakened bones. Century. By directly strengthening bones and enhancing balance, exercise is a powerful tool against fractures. Century. Benefits for your bones. A combination of different exercise types is recommended. Weight-bearing exercises are activities where your gravity. Century. Forcing your bones and muscles to support your weight. This stress is what signals your bones to become stronger. Include walking, jogging, hiking, dancing, climbing stairs, jumping rope, and low-impact aerobics. Even simply standing and moving your body contributes. Century. 60 minutes of weight-bearing exercise most days of the week, ideally 3-5 times per week, which can be broken into shorter sessions throughout the day. Training or resistance exercises use resistance bands or your own body weight to build muscle strength. As muscles pull on your bones during these exercises, they also stimulate bone growth and density. Examples include lifting free weights using gym weight machines, working with resistance bands, and bodyweight exercises like squats, lunges, push-ups, and planks. Perform strength training exercises 2-3 times per week, ensuring you work all major muscle groups and allowing a day of rest between sessions. Flexibility exercises, while not directly building bone density as much as weight-bearing training, are incredibly important for preventing falls. Century. Good balance and flexibility significantly reduce the risk of tripping and fracturing a bone. Chi yoga, standing on one leg with support initially and heel to toe walking are excellent for improving back exercises enhance flexibility. Century. Incorporate balance and flexibility exercises into your routine daily or several times a week. Century. When starting an exercise program, it is important to gradually increase intensity. If you are new to exercise or have been inactive, start with gentle activities and progressively increase the duration and intensity. Century. Always listen to your body between muscle soreness and sharp pain. If an exercise causes sharp pain, Century. If you have existing bone loss, such as osteopenia or osteoporosis or other health conditions, consult your doctor or a physical therapist before starting a new exercise program to ensure it is safe and effective. Century. Proper form is essential to prevent injuries and maximize workout benefits. Consider working with a certified trainer to learn correct techniques. Century. It can sometimes be challenging to obtain all the nutrients your bones require, which is where supplements can be beneficial, though their use must be carefully considered. Century. It is always crucial to consult a healthcare professional, such as your doctor or a registered dietitian, before starting any new supplements. They can help determine if supplements are necessary, advise on the correct dosage, and check for potential interactions with existing medication. If your dietary calcium intake consistently falls short of the recommended daily amount, a calcium supplement Century applies if your daily food intake of calcium does not reach the recommended 1,200 mg. Calcium carbonate is a common form with a higher amount of elemental calcium, the actual calcium your body absorbs, and is best taken with food as stomach acid aids its absorption. Calcium citrate is better absorbed, particularly if you have low stomach acid or take stomach acid blockers, and can be taken with or without food. To optimize absorption, calcium is best absorbed in smaller amounts, so if a supplement is needed, typically take 500-600 mg of elemental calcium per dose. Total daily calcium intake from both food and supplements should generally not exceed 1,200-1,500 mg unless your doctor advises otherwise. Calcium supplements can sometimes cause constipation, and there is a potential for an increased risk of kidney stones in some individuals, especially if insufficient water is consumed. Medical studies have explored a potential link between high-dose calcium supplements, particularly without adequate vitamin D and K2 concerns, though this area can Century. Many people do not get enough vitamin D from sunlight or food, especially in certain climates or during winter, making vitamin D supplements often necessary if blood tests indicate levels below optimal, generally less than 30 ng/ml or 75 mol/gl. Vitamin D3 called calciferol is typically preferred as it is generally more effective at raising blood levels than D2. Doctors commonly recommend 1,500 IU international units per day, but the precise dose should be determined based on your blood test results and your doctor's advice. D toxicity is possible with very high doses over an extended period, and it can also interact with certain medications, such as steroids or some weight loss drugs. Consume vitamin K2, rich foods like natto or certain cheeses. A supplement might be considered, especially if you are taking calcium and vitamin D. Forms are MK4-zamenquinone 4 and MK7-menaquinosin, with MK7 often preferred for bone health because it remains in the body longer. Typical doses for MK7 studies are 91-80 micrograms per day. MK4 is sometimes used in higher doses, such as 1.55 mg daily in specific therapeutic contexts, but this is less common for general bone health. It is crucial to note that vitamin K2 can interfere with blood-thinning medications like warfarin as Coumadin. Therefore, if you are on blood-thinning, you must consult your doctor before taking any vitamin K2 supplement. Many individuals do not obtain sufficient magnesium from their diet, yet it is essential for bone health. Dietary intake is consistently inadequate or blood tests reveal low magnesium levels. A magnesium supplement may be beneficial. Citrate, glycinate, or malate are generally well-absorbed forms. Magnesium oxide should be avoided if your primary goal is as it is poorly absorbed and mainly functions as a laxative. Typically 200-400 mg per day is recommended, often split into two doses, such as 200 mg twice a day, to enhance absorption and reduce potential side effects. Hydrogen can cause diarrhea and may interact with some medications, including certain antibiotics or diuretics. Essential supplements include boron, which is thought to support the metabolism of calcium and magnesium, and is sometimes included in bone health supplements. Strontium citrate is a more complex supplement that can interfere with DXA scan readings and is considered a prescription drug in some countries. Its use should only occur under strict medical supervision and is generally not part of a simple plan for most people. Beyond diet and exercise, your daily habits and how you manage your life can significantly influence your bone health. Smoking is paramount, as medical research clearly demonstrates that tobacco is toxic to the cells responsible for building bone and impairs the body's ability to absorb calcium. Smokers typically exhibit lower bone density and face a higher risk of fractures. Therefore, stopping smoking is one of the most beneficial actions you can take for both your bones and overall health. While moderate alcohol consumption may be acceptable, excessive drinking is detrimental to bone. Too much alcohol can hinder the body's absorption of calcium and vitamin D and slow down bone formation. It also increases the risk of falls, which can lead to fractures. Experts advise limiting alcohol intake to no more than 1 drink per day for women and 2 drinks per day for men. Chronic stress can result in persistently high levels of stress hormones, such as cortisol. Cortisol levels can negatively impact bone density by accelerating bone breakdown faster than it can be rebuilt. Ways to manage stress through practices like mindfulness, meditation, yoga, spending time in nature, or engaging in hobbies can support overall health, including bone health. Maintaining a healthy weight is also important, as both being excessively thin and severely overweight can negatively affect bone health. Being underweight, particularly in women, can lead to lower estrogen levels, which are crucial for bone protection. Being severely overweight places additional stress on joints and can lead to inflammation that impacts bone. The goal is to achieve and maintain a healthy body weight that is appropriate for you. Even a fall can result in a fracture, making fall prevention especially critical if you have osteopenia or osteoporosis. Strategies for home safety include removing tripping hazards such as loose rugs, keeping pathways clear, and ensuring adequate lighting in all areas, particularly on stairs. Installing grab bars in bathrooms and near stairs beneficial if needed. Regular vision checks are important as they increase your risk of falls. Get your eyes checked regularly and update your glasses prescription as necessary. Reviewing medication pharmacist is also vital, as some medications can cause dizziness, drowsiness, or affect your balance, potentially increasing your fall risk. Exercises, as previously mentioned, such as Tai Chi or standing on one leg, can significantly improve your balance and coordination. Their likelihood of falling. Century. While exercise and lifestyle are powerful tools, sometimes medical intervention is necessary, particularly if bone loss is severe or progressing rapidly. It is important to discuss your bone health with your doctor, especially if you meet certain criteria. 65 and men over 70 should generally discuss bone density screening with their doctor. If you experience menopause before age 45, your risk of bone loss increases. Century. Warn with your physician. Century. Agility fracture, meaning a bone broken from a fall from standing height or less, is a strong indicator of underlying bone weakness. A strong family history, century, or sibling with osteoporosis or a hip fracture, also places you at a higher risk. Century. Medications known to cause bone loss, such as long-term corticosteroids, your doctor should monitor your bone health. Century. Unnoticed or a stooped posture can be signs of spinal fractures caused by osteoporosis and should prompt medical consultation. Century. If and supplements prove insufficient, or if bone loss is severe, your doctor might suggest prescription medications. Century. These are various mechanisms to slow bone breakdown or stimulate new bone formation. Century. Alendronate, Fosamax, and risedronate actonald are common medicines that slow down bone breakdown and can be taken daily, weekly, or monthly, administered as an intravenous infusion. Denosumab Prolia is an injection given every 6 months that also helps to slow bone breakdown. Medications categorized as bone-building agents like teriparatide Forteo and abaloparatide Tymlos actively help the body. Century. These are given as daily injections for a limited period. Zumabaventadide is a newer medicine that both increases bone formation and decreases bone breakdown, administered as monthly injections for 12 months. Some postmenopausal women, hormone replacement therapy, HRT, can help prevent bone loss, but it also carries other risks and is generally considered after other options. A woman requires it for other menopause symptoms. On a plan for stronger bones, monitoring your progress is essential. Your doctor will likely recommend follow-up DXA scans, typically every 1-2 years. Century. Bone density is improving or remaining stable. Century. Checking your vitamin D levels and other markers through blood tests can help ensure your treatment plan is effective and that you are receiving adequate amounts of key nutrients. Century. Steps to manage your bone health is a powerful investment in living a strong, active life. Century. Not an inevitable aspect of aging, and with the correct approach, you can significantly enhance your bone strength and reduce your risk of fractures. Century. The plan for stronger bones involves a comprehensive combination of strategies working in synergy. Century. On obtaining sufficient calcium, vitamin D, vitamin K2, magnesium, and protein from your diet, while limiting foods and habits that can harm your bones. Century. For exercise, age in weight, bearing activities like walking or dancing, and strength training exercises such as lifting weights or bodyweight exercises to stimulate bone growth. Crucially, do not overlook balance exercises to prevent falls. Century. Modifications include quitting smoking, consuming alcohol in moderation, effectively managing stress, and maintaining a healthy body weight. And maintaining strong bones is a continuous process akin to a marathon rather than a sprint. Century. Nutritional choices, exercise routine, and healthy habits over the long term is paramount. By adopting a proactive approach, empower yourself to take control of your bone health and invest in your future well-being. Century. Discussion offers a comprehensive guide. Always remember to consult with your healthcare professionals for personalized advice. They can help tailor this plan to your specific needs, conditions, and individual risk factors. A future with stronger bones and a reduced risk of fractures is an achievable goal, enabling you to enjoy an active and independent life for many years to come.